everyone. Welcome back to the podcast. I'm Dr. Lindsay Renzullo.
I'm Dr. Vernaleken.
And today on our episode, we have a wonderful guest, Dr. Gracey Welsh. She is a veterinarian from Peak, which is up in New Hampshire, but she also has sort of cross responsibilities for another veterinary hospital, right? Up in Vermont.
Yep,
No.
exactly.
Yep.
Yeah.
And she's here today to talk to us about something that we're seeing very often that's starting to come up in the veterinary world, which is sort of these urgent cares. And urgent care is sort of a new idea into the veterinary world. And so we are happy to have her here to sort of talk to us about urgent care. But before we get to that, Gracey, please let us know a little bit about yourself, where you went to school, and a little bit of a background.
Sure, sounds good. So my name is Dr. Gracey Welsh. I am from upstate New York originally, the Lake Placid region. Did my veterinary training at Cornell out in Ithaca, New York, a couple of years ago now, and then joined the Ethos team. So started initially at Capital District and Peak. So Capital District being in Latham, and then Peak in Williston, Vermont, and have since moved to the Lebanon, New Hampshire area, where I am based out of Saves, which is another one of the Ethos hospitals. My title is Associate Medical Director of Emergency Medicine at Saves, and then also directing the urgent care up at Peak in Williston, Vermont. And we opened that urgent care at Peak in July of this year, and things have been going very well. So
You've got a lot going on. Yes.
a lot going on. Yes,
You've got your hands in lots of different spots, lots of different locations.
exactly.
So tell us a little bit about this sort of urgent care, it being a novel-ish idea, I guess, in veterinary medicine. We didn't necessarily have particular facilities like dedicated to urgent care alone. So tell us a little bit about like what happens on an urgent care facility compared to someplace else.
Yeah, so I think, what I have talked to veterinarians and owners about is urgent care is something that's so normal in human medicine. I think a lot of people have been to an urgent care center themselves. And so they kind of know what that looks like in the human field. In veterinary medicine, it's really never been a thing. You either went to your regular veterinarian and you saw them for sick visits and well checks and kind of the whole, normal care. And if you needed to be elevated either after hours or you needed specialty care and workup, you would be referred by your regular veterinarian to one of these bigger hospitals. Since the pandemic started and veterinary medicine has been experiencing this just boom in caseload, there really has kind of turned out to be this group of patients and clients who weren't able to seek care in either of those two places. So maybe the general practices were overwhelmed; they couldn't fit in the same day appointments that they may have before, and at the same time, the ERs and the specialty hospitals were at capacity with, these critical cases. And so you had this subset of patients who needed veterinary care and couldn't access it. And so seeing that was a strain on the system in a lot of places, this idea of the urgent care scenario kind of came to fruition.
Mm.
And so essentially our goal and our aim is to help meet those patients who need that care that can't really wait a couple of days for the general practice, but maybe isn't sick enough to be rushed to the front of the triage line at the ER specialty hospitals. And so that's kind of where the idea was developed from.
Mm.
Yeah, it makes sense too. I think most people understand it having worked their way through the human healthcare system. And yet, like, it's surprising to me actually that it has taken sort of this long to have it occur in veterinary medicine because our ER doctors, while they're able to deal with pretty much everything that they come into contact with, there's always this like struggle with, well, we always use the ear infection as the scapegoat. Like an ear infection is not life threatening. It technically can wait as long as it needs to wait in order to be seen, but it's super, I mean, when you're awake with your dog at night and it's
Right.
shaking its head and it's bloody, like, and it's in pain, it needs
Right.
to be seen, but it's going to sit there in the ER for 8 hours because every other emergent thing is going to come in and bump it and bump it and bump it. So it's
Exactly.
yeah.
And those are the cases that we're, looking at. So as a list of, urgent care type cases, we're talking about the ear infections, the urinary tract infections, the limping or the lameness issues that pop up. Maybe they overdid it on a hike or something. They're still stable and they're eating and they're drinking, but they're uncomfortable and they're painful
Sure.
and they do need care. And like you said, they would wait at an ER, scenario. And so it's giving those people and those pets a place to go and be treated.
And it's sort of handy. I mean, with the urgent care facility in Vermont, um, actually both myself and Krista had the pleasure of going up there and just sort of experiencing a little bit of, how your workflow goes. But in essence, I mean, clients are able to make appointments, which is also a little bit unique, to, a more of an emergency facility. People, when they go to an emergency facility, it's first come, first serve, and it's based on triage, right? So if you have a really critical thing that's there, but you might have been waiting for a long period of time, just because you were there first doesn't necessarily mean that you're going to get seen first. You're going to get bumped based on the triage system. Whereas with urgent care, you actually have sort of set appointment times, which is very handy and nice. So owners are not necessarily waiting for hours on end.
Right. And that's another big goal, obviously, is trying to make it convenient for the pet owners, because we can all argue, not fun to sit in the parking lot or the lobby of an emergency hospital for 8 up to 12 hours, sometimes on the weekends right now. And so giving them that opportunity, hey, can you bring Fluffy down at 2 o'clock? Great, we'll
Right.
see you then. They can plan their day around that. Our team's ready for them when they arrive. And it should work, similarly to your general practice visit. We know they're coming, they come in, we do the appointment, diagnostics, treatment, and out the door they go. And so hopefully it's a pretty streamlined process for the owners and the pets.
Mm.
How does an owner know that their case is urgent care eligible? How do you propose that an owner make that decision?
Yeah, I think that that's really hard, because there is just this gray area that's sort of in between. We do the best that we can with, telephone triage and talking to owners on the phone, and kind of listening for some of the big worrisome concerns, difficulty breathing, altered consciousness level, or very abnormal mentation or behavior. And our client care and our client service representatives are really good at picking out some of those overarching themes and saying, hey, I don't think that this is an urgent care case, and you should really seek veterinary care at an emergency level facility. Certainly cases do squeak through, and because maybe the perception of the owner doesn't necessarily match the severity of the disease. We know dogs and cats can be really good at hiding when they're very
Hmm.
sick. And so we have had cases that come through the urgent care, and it's pretty clear that they need to be upgraded to a different facility. Our urgent care doctors are emergency veterinarians that kind of prefer the urgent care track, and so they are very technically capable of dealing with these cases when they slip through. Their goal is going to be to stabilize, have the conversations with the owner about what ongoing care looks like, and then get those pets to the appropriate place. So, for instance, in Williston, there are a couple of nearby emergency facilities that can take those cases. Very similar to what would happen if you walked into your general practice and your dog was really, really sick. We're going to go through that same stabilization process, make sure that the owner's understanding of what's going on and what's required for that next level of care, and try to make it as safe as possible to get that pet where they need to go.
And I would
Yeah.
imagine it's been very well received amongst your referral community in that area, just because it does probably provide a lot of relief for them. I mean, they are busy general practice facilities that are trying to, not only take care of all of their wellness appointments, but they do have sick animals they still will see through their facility. And so knowing that there's some other place to kind of help relieve some of that extra overload of cases must be very well received.
Absolutely. And our big goal going in has been, to complement what's already in the area for veterinary medicine and not compete with what's already in the area. But I think you talk to any general practitioner right now, and they're going to say they're still overwhelmed. They're not accepting new patients. There's just still such a high volume of patients that need to be seen. And so taking that strain off allows everybody to practice better medicine, to not feel rushed, and then to make sure that all the pets and clients are taken care of. And so the referring partners have been really, really great in the Williston. So for anybody who doesn't know, it's kind of a suburb of Burlington, so to speak. So we get a lot of, second homeowners or tourism, people coming in to hike with their dogs or visiting for a week, at the Airbnb with their cats. And so those people don't have a regular veterinarian in the area. And again, maybe these aren't life-threatening, illnesses or injuries, and they don't meet that emergency standard, but the general practice down the road can't squeeze them in. They're not an established patient. They don't have that relationship, and they just don't have the time to do it. So certainly it's taken the strain off of the general practitioners and the emergency clinics in the area. As an emergency veterinarian, I think you guys can both agree, it's stressful when you know that that patient has been sitting in the parking lot for 8 hours,
Right.
And it's not going to take you that long to help them, but you just can't get to it. You need to deal with the sicker things first. And nobody wants to make people wait for hours and hours and hours on end. And so taking that load of those less critical cases off of the ER plate is hopefully helping again provide better medical care to the patients who really need it in those ER settings.
Yeah, that's I mean, something that I heard once from a client, and I understand where they were coming from, but it's also the perception is frustrating that like, well, I waited this long and it was this
Right.
like really dumb thing. Like even the client knew that this was going to be super quick.
Mhm.
But they say to me, but I don't understand why they couldn't have just gotten me in and out. Like that is all very true, but that person who has the life threatening their dog has a life threatening situation where really a doctor needs to be on that patient 100%. Like, they don't want them stepping away to deal with the ears or the nails or the skin or whatever it is, even though it would be quick. It's still 20 minutes. It's still half an
Right.
hour of time that you're spending. And really the client with that less severe concern still expects that you're going to put all of your attention onto that issue, right? So we only have so much bandwidth in the end. And so, yeah, I've often wished that, I mean, our hospital is sometimes in that weird position where we have the general practice. And so one of my clients calls and says, well, I have this issue. And like, I physically can't fit in another one. But I know that the ER probably can't see it either. We're in the same building, so we're like sort of stuck. Like we've got to get this case in somehow. So I think urgent care is something that many hospitals are considering adding, even if they're already an ER hospital.
And
Mhm.
it's definitely changed, right? I mean, I would say that the veterinary field, I mean, I don't know what year you graduated, Dr. Welsh, but I mean, for us, I mean, even from where I had been, I've been out almost 14 years, it has changed, as far as what our needs are, as far as staffing levels and being able to provide care for the patients that we have. And so, it just feels as though it's like a nationwide thing where, you do have more of a need for these urgent care, places than ever before. And I know, as far as, seeing those cases in an organized fashion, it's got to be something that is a little bit better because they are things that need to get seen. I think that everything that goes in that urgent care, they need to be seen. And even if it is something where you're just sort of alleviating an owner's concerns, it is important to have that pet assessed and have that situation addressed. Um, because sometimes people can think that it's a big deal and it's not, and other times they don't think it's necessarily a big deal, but it actually is. And so I don't, I think the phone triaging, the way that we're trying to sort of manage it and curtail some of these cases coming in is hard. It's really very hard. And so having a facility that can at least say, yes, bring them down, let's take a look at them. It makes everybody feel better that, somebody can actually take a look at that pet.
Absolutely. And I think that, it's sometimes curbing things as they come up, right? And so maybe your dog is vomiting and it's only been a couple of hours and they're not that sick right now, but if you wait 3 more days to seek
Right.
care, it could be a lot worse. There could be some significant dehydration or, other changes. And so being able to have the ability to get them in as soon as things, present and start, I think it's helpful to these pets and it can help prevent things from getting worse for sure.
Yeah. Would you say, since starting these urgent care facilities that you guys have pretty much been booked out like every day? It seems to be busy.
It's definitely hit or miss, just I think with everything else right now, but certainly much higher than expected in terms of caseload. When we went and started this, we didn't have much to compare to, right? This is a
Right.
completely new service for the veterinary industry. So we kind of picked some benchmarks and said, hey, if we could hit these, I think that would be great. In terms of, how many cases do we expect to see in the Williston area? And we've been busier than we anticipated since we
Mm,
opened.
yeah.
So say start to finish, most clients have been to a general practice visit, right? So they know how that
Hmm.
works. Generally speaking, the amount of time investment and all of that. And a great deal of clients, I think, have been through ERs. So they kind of know how that goes and how there's a difference, contrast with who takes histories, where their pet goes, does their pet stay with them the entire time or move out of, the space for most of the visit. With my point being that in general practice, it tends to be that you kind of stay focused in the room with your pet most of the time, have the visit with the vet, do many of the services in the room, and then in an ER environment, at least at our hospital, a lot of the time that's a mixed um,
Hmm.
situation where, the pet will move out back and do some different testing. And a lot of the time the severity is higher. So, we'll be talking about hospitalization. How does the flow, where would you say that it's more like the general practice? Is it more like the ER? What can a client expect?
I think it definitely is in the middle of that spectrum, but probably more towards the general practice side. So there's definitely, that in-room consultation with the veterinarian, with your pet there after that initial, technician, nurse, history taking, vitals assessment. The veterinarian's going to come in, sit down, have a conversation with the owner. Again, because we have sort of an appointment schedule, they have the time to do that, right? You can
Hmm.
expect to have that conversation, that back and forth, the pros and the cons of the different treatment options and diagnostic options. And then, if they need blood work or x-rays or any, additional treatments, we do usually take them out of the room for that, probably much like they do in general practice, and then return them to the pet, or to the owner again at the end. I think it's been really, one thing for me that I've been observing again in the ER, maybe you have some more of these like bridging on chronic conditions, and as a veterinarian, you want to have that conversation about long term management or about
Mm.
options that are out there. You just can't do that right now in the ER, right? And so there's a lot of take all of this information, it's written, follow up with your regular veterinarian, and kind of we put it back on the client a little bit. At urgent care, they have that ability to kind of sit down and talk about it and have those conversations. And so it definitely is in the middle of that spectrum, but I think much more of a general practice type experience for the owners.
Mm.
And in terms of like, who do you see in terms of veterinarians that want to pursue this as a career? Do you see that a lot of vets want to be full-time urgent care doctors, or do you have ER vets that just do a shift or two as an urgent care type person?
I think again, because it's an emerging service, it's going to really depend. I think that there are a lot of benefits to the urgent care career track. So certainly, if you are a newer veterinarian and maybe you're not that comfortable with walking into an ER, on your own completely, and being responsible for that severe of a caseload, this might be a good first step. Getting your feet wet, so to speak, with some of the less urgent but still urgent cases. I also think that in the time, as this goes on, I think a lot of the ERs are going to have urgent care, or at least fast track urgent care departments. And so it might be a place where you can come in as an urgent care doctor and hey, there's something really cool going on in the ER, or you can kind of get stepped in that direction as well. I also think from the other side, and not to talk about it as like ER versus GP, but from the other side, you get to practice really good, high quality general practice medicine, with sick pets. You get to have those conversations with owners. You get to kind of deal with some of the, more day to day sick visits, but you don't have that responsibility that sometimes falls on general practitioners for the, long-term relationship building and kind of checking in with your clients. And, it's sort of you see what you see on urgent care, and somebody else is going to take care of these pets. They're going to go back to their regular veterinarian. And sometimes for people who are, a little bit in a different place in their career, that can be nice too, to just know that you're coming, you're doing your job, and some of that more, long-term chronic care is falling on the general practitioner.
It's
So
funny. I do both myself and Krista will both do, some ER shifts as well as general practice shifts. And I do love my general practice shifts. I love the clients, and I've known some of these people for over, 10 years, and you'd be following all their pets. And it's awesome because you can see that relationship build and grow, and you're taking care of that pet, and you really feel like an ownership within that family too, which is an awesome feeling. But there is something awesome as well about just going and doing an emergency shift, seeing a bunch of really cool things, and then yeah, like that's it for me. I mean, you can send them the discharges and all that stuff, but you know I say that jokingly. I mean, obviously I still follow up with the emergency cases somewhat, but in the general it's just a totally different relationship. It really is. And so you're able to really treat and do a lot of cool things. I love doing surgery, and then knowing that they can follow up with somebody that they have as a general practitioner is a very awesome experience as well.
Do you have clients that do try to follow up through the urgent care service on occasion?
we definitely do. And I think that again, just with the clientele that we have, some people are from out of town, and maybe they're there for a couple of months, or they're doing a stint at the college or something, and they're there for kind of a transient period. We've definitely had some, wounds or injuries, and they come back for bandage changes and
Right.
follow up care for that initial thing. And so there is that aspect. We also are pretty good, and we think it's really important to follow up with the clients that we see. So everyone's getting a phone call, a day or two later. Hey, how are they doing? How's everything going? We're super open to kind of those follow up questions. So they're getting that follow up and making sure
Right.
that everything's going well. Um, we try to, dissuade them from using us as their general, practice. We don't carry vaccines aside from rabies
Right.
vaccines. We're not doing that preventative care side of things because it doesn't need to be done on an urgent basis.
Right.
But certainly, there's people like, can I come back next week for my vaccines? Like, no, you should go back to your regular veterinarian for that. But
Yeah.
Well, you were there for them in their moment of need, and so I
Yes.
do see that
Yeah.
a lot through emergency as well, is that they
mhm,
they really emotionally bond to the person who perhaps saved their pet's life or really just helped them out in a tough spot. So
yeah,
now they love you. Yeah.
Yeah. No, it's true. And they get very bonded, which is understandable for sure. Do
mhm.
you have any, now that you've been doing this urgent care service for a bit, do you have any urgent care cases that you can remember that was a very, positive case or very rewarding, anything like that that would sort of just come to the top of your head?
I think, the one, so this kind of comes back to the follow-up is we had this, his name was Connor, and he was a German Shepherd dog, and he fell and broke his leg. He's a little puppy. And so he came through urgent care for, limping. They didn't know that he had had kind of a trauma or a fall. They just kind of woke up one day and he wasn't putting weight on his foot. Took some x-rays. He had a fracture of his leg, placed a cast, got him started on some pain medications, and he was actually able to follow up with the surgery service within the same hospital as the urgent care. He had surgery to repair the fracture, and then because he was kind of a naughty little puppy, he had to come back pretty frequently for cast changes and bandage changes because he got them wet or chewed on them. And so I think we're at like week 6 post surgery now, and we've seen
Oh,
Connor pretty frequently. But he's a super cute little fluffy German Shepherd puppy, so everyone kind of loves following his case along. But again, just a great experience for him, for the owners. At the time, they just gotten the puppy. They didn't have a regular veterinarian to go to, but
yeah.
he was hurt and he clearly needed help. And so we were able to provide that, get him to the place that he needed to be for surgery, and then have continued to be there for him, throughout his healing. So,
Oh, that's
When I was
awesome.
up at Peak, there was a case, and this is sort of the almost the opposite thing where, a case that was really very much more urgent came in through the urgent care service. And I remember the doctor who was on, like, could tell from the way that it was booked and the presenting complaint, like, this is going to be maybe not appropriate for this hospital. But then they had called, one of the local hospitals who had said, "Well, maybe we'll be able to see it. It's, they'll sit, but the wait right now is 6 to 8 hours." And I don't think they fully grasped sort of the severity of the situation either. So it had been somebody that had been to the hospital before, and so they came, and the doctor's instinct had been right that this was really not okay for urgent care. This animal was going to need a ton of monitoring and hospitalization and everything. And but she did all of the, initial stabilization, and then, called over to the local ER and explained the case and got it right in through that ER. And it was a very smooth and seamless process for that owner, where it could have been a situation where this pet sat in a waiting, like in a car for many hours before they even like realized how bad it was. And that's
Mm,
not an indictment on emergency. It's just the world. Like, I don't think that client understood the severity of everything, so
right.
he wouldn't have, necessarily promoted, "My animal needs to be looked at immediately," and would have just kind of waited there, you know.
hmm
Well, and that is one of
Yeah.
the difference though, like between veterinary medicine, and I sort of alluded to it earlier about like veterinary medicine versus human medicine. I mean, in human medicine, if you, are concerned about yourself, you can't call a human ER and say, "Can I just triage my symptoms?" They'll just say, "Well, you got to come down." We are trying to sort of navigate, that, and trying to prevent owners necessarily from coming down if they don't need to, but it isn't always a perfect system. And so doing a lot of the phone triage that we do, I think, can be very helpful in some cases, and then other times it can be very difficult to fully assess things over the phone. And I think we do it for a variety of different reasons. I do think that we do it trying to help the clients out, like trying to figure out ways to help the clients out so they're not necessarily coming down to the hospital if they don't necessarily need to. And also just helping how busy the ERs are. I mean, the ERs can be very, very busy and overwhelmed. And so trying to figure out who really does need to come down. But to your point, Krista, it's not always perfect. And having them at least be seen by the urgent care was able to sort of have that patient appropriately assessed and get to where they needed to be, which is great.
Yeah.
And I think
Yeah,
a
and
lot of
having a place to have it
sorry.
looked at. Sorry.
Yeah. No, I was gonna say, and I think a lot of owners that's worth it to them.
Yeah.
They'll come in, and I can't tell you that on urgent care we see a lot of cases, and we're like, yeah, it looks like this might be going on. We could do these tests, we can do whatever. And like, I'm gonna wait. I have an appointment in 2 days with my regular veterinarian, and I'm gonna keep that. I just wanted to make sure that I didn't need to
Right.
do anything right now. And so just that peace of mind of somebody's evaluated my dog and or cat and can say, yeah, it is okay to wait 2 days, to do those diagnostics and to follow up with your regular veterinarian because you don't know. And people love their pets and, rightly
Right.
so, want to make sure that they're not doing a disservice by waiting.
Yeah.
So one
Definitely.
question that has come up is kind of what the diagnostic capabilities typically are for urgent cares. And I think the important thing for everyone listening to recognize is that these are uncommon still in the veterinary field. So there may be some variety, but say in terms of blood testing or advanced imaging, what do you have that or what do you not have, I should say, I guess that an emergency hospital might have?
Yeah, and I think, like you said, it's going to vary depending on where you are and how they're set up. So for us at Peak, we are an urgent care service within a specialty hospital, but we try pretty hard to respect the boundaries of the specialty, caseload there. They're very busy as well, and so we kind of focus on, if possible, keeping things within the urgent care. We have point of care blood work just like you would get, in emergency room or in a general practice. So we can run full panels of blood work, get a lot of really good information from those, urinalysis, fecal flotations, right in house. We can do all of that.
Mm.
We have the ability to send out, additional lab work or special testing, if indicated, with a turnaround time, obviously, on those things. But sometimes it's important to know. We have a point of care ultrasound. So all of our veterinarians, are going to be proficient in that, quick, fast scanning, we call it, just kind of looking, is there anything major going on that we need to worry about in the chest, with the heart, in the abdomen, right at this moment in time? But that is definitely not diagnostic ultrasound. And so that's a
Hmm.
big thing that we stress to owners. A lot of people say, my vet said I needed an ultrasound. Will you have an ultrasound machine? Sure, but that does not make us radiologists or internists who are specialized, in the craft of performing ultrasounds for a true diagnosis. Um, we have X-ray capabilities. Again, that's going to be kind of where we're at for diagnostic imaging. And arguably, if you need more than that, you probably shouldn't be in the urgent care. You should probably be somewhere else. But I think we have, a really good, solid first look point of care, diagnostic ability, at Peak. Same with treatment. We can do those stabilizations. We have the oxygen, capacity. We have fluid capacity. We have the ability to intervene very quickly and appropriately if those cases slip through who are sicker than we initially thought.
Mm. And I know a lot of owners sort of, are getting pet insurance is becoming much more popular. And owners that have pet insurance, are always wondering, does this pet insurance apply if I utilize it to going to an ER or to an urgent care? So, is it something that this pet insurance is typically accepted through urgent care visits?
I think it totally depends on the insurance that you have. And I definitely always tell owners, make sure that you are aware of, how the wording is for everything. But as far as I'm concerned, these would be considered emergency or urgent visits. And if you have a policy that covers those, it should be covered the same, whether it's at your general practice, whether it's at your urgent care, whether it's at an emergency facility, that should all be covered the same, I would think.
Yeah.
Yeah, I think that a lot of owners that even have insurance don't fully understand their policies, which is I would advise that you do, read the fine print, talk to your insurance provider to understand what it covers and what it doesn't. But there's not really the concept of a veterinary practice accepting insurance in veterinary medicine because all of it is you pay for the services that you received and then you as the owner
Right.
usually get reimbursed. So the pet insurance generally doesn't care where you went. They just have what they cover and what they don't cover. And so some of them, most of them do cover emergency or well care and they don't really distinguish. But some of them will only say we cover only really sick things, we cover these services, but not these. So you really should understand the policy that you have.
Yeah.
Do you see do you see exotics at your place?
We do not see exotics right now. I don't know if that will expand. It will take somebody who's comfortable, to offer those services.
Yeah,
That's a good
exotics are a
point. I mean,
tricky one, very
yeah,
tricky.
exotic medicine is tricky because for a few reasons. I mean, there's not a lot of veterinarians in general that sort of see or feel comfortable seeing exotic. The exotic medicine is very different. These pets all have very specific needs for like husbandry and different care. And so I can see,
Gosh,
just
they have
wanting the
entirely different anatomy. Like
yeah,
the way their lungs work is entirely different. So I don't think, when people get a reptile, maybe they don't realize it's so different that what I learned does not apply.
right, right.
It's our
And
joke here at Saves on the ER when we get those phone calls. Like, do you see rabbits? Like, you don't want me to see your rabbit.
Yeah. And then, I mean, if, there is a time where somebody calls in with a pet that is, really not doing well, or, you're looking at sort of end of life discussions, is that something that urgent care facilities, provide to their patients?
Absolutely. And so that is something that we do a fair amount of on the urgent care service, and also on the ER service. I think you guys are aware of that from working in the ER. Unfortunately, those decisions sometimes get made or become very evident after hours, and
Yeah.
so I think it's important for owners to know that they have an outlet, for making those decisions and having those conversations that doesn't necessarily fall, within the general practice operating hours. And so always, a lot of respect to the owners. We know it's not an easy decision to come to. The doctors, technicians, the entire staff are available for consultation if it's a question, quality of life concerns or consultation. We can walk through that process. Also, a lot of people call and say, I know I've made my decision and it's time. It just happens that it's 9 o'clock at night. My regular
Right.
veterinarian's not open, and I don't think that my pet should wait overnight. And so certainly that is something that, we can provide. I think it's hard, if you have a general practice veterinarian, they've known your pet for a long time. There's a relationship there. But I also think that, our team really strives to make it as personal as we possibly can. And, again, respectful. We've all been there. Everybody, has pets, loves pets, has had to make that decision a time or two. And so just because there isn't that long-standing relationship doesn't mean that it can't be as good an experience as possible.
Yeah.
yeah,
And I
I've
mean,
run into a fair number of clients that did not they want to continue
yes.
my seeing me, and they don't want me to be associated with that experience. So they actually want someone who's just kind of a neutral person who can provide the emotional support but not be like the one. I've had some clients that wouldn't enter the room where they, euthanize their pets.
Right.
So you quickly run out of rooms in your small animal hospital if someone can't be in the same room as that again. So, yeah.
I was
That's
gonna
a
say the
good
same
point.
thing. I've had clients that have specifically gone, I feel like off hours, to the ER because they just didn't want me to do it. And they've said it. They said, I didn't want to see you, being the one. But then on the flip side, you get other owners that just do want to have that
Only you. Just
only
you.
you. Yeah.
Only you. Yeah.
So yeah, I think it's a hard service to provide. It's one of the hardest things in veterinary medicine that we do. And, depending on the case and the animal and why they're needing to sort of have that end of life, it can vary definitely emotionally on you. You have a 16-year-old dog that's lived an awesome life, and it's time. Is a much different experience than, a 2-year-old dog that has, cancer, and that this is the end for that dog. And so it's totally different experience. But I think providing that care is very special. Yeah.
I always say it's one of the most important things we do as veterinarians, I think,
Hmm.
as hard as it is.
Yeah, absolutely.
Gracie, is there anything else you feel like we didn't cover that you want to make sure get out there about urgent care?
I mean, I don't think so. I think that that's kind of the basics on it. Just think it's an important thing for owners to be aware of. It's out there, it's coming. I think that we're going to start to see a lot more urgent care facilities pop up. Like I said, they might be standalone, they might be within an already operating general practice or within an emergency facility. But I think it's a really great thing that we can offer pets and their owners right now.
It's awesome. Well,
Awesome.
we're very
Well, thank
happy to have you. It's definitely, even though I wish, we had more urgent cares sometimes in our area to help with the overflow. It's very nice to have you, and it was wonderful to have you on the show. We want to thank you for joining us, and to our sponsor, Ethos Veterinary Health. You can also follow Ethos Hospitals on social media and at ethosvet.com.
And please
Awesome.
rate and review us on your favorite podcast platform. You too, Gracie.
I will do that.
And on YouTube. So have a great day. I'm Christopher Nalikin.
And I'm Lindsay Renzullo. We'll see you guys next time.